So some people watching may be caregivers of someone with a brain injury. Do you have any general tips for caregivers?
It's interesting as far as caregivers. When I first had my brain injury, I needed people to help me, and now I'm actually a full-time caregiver for my 81-year-old father who's had a brain injury. So besides dealing with my own issues, I need to deal with his, and he needs to deal with mine. A couple of really important things. No matter what condition the person you're taking care of has, you need to take care of yourself. If you don't keep yourself healthy and keep your emotions and your mental health in a healthy place, you're not going to be a very good caregiver. As far as people with brain injury, a couple of really important things. One is find a local brain injury support group, both for the person who has the brain injury and for yourself. And some support groups have even developed support groups for caregivers, which is a whole better level where you can interact with other caregivers and be outside of the space of the person you're helping, so that you can be blunt and open and talk about concerns and problems. The other thing for caregivers is you need to get information. And for those with brain injuries, there's a National Brain Injury Association, the Brain Injury Association of America, and on their site they have lists of all the state associations. They also have lists in the state associations of all the support groups. So there's all kinds of resources, support, networking, advocacy. Many states have conferences, and those conferences often are open to providers, people taking care of those with brain injury, as well as family members and those with brain injury. So it's a place where you can learn a lot of information. But find somebody to support you, network with other people to get information, and if you can, find a local support group. Those are all really important.